This Tuesday sees a special meeting of the Social Council of the Bolivarian Alliance for the Peoples of Our America People's Trade Treaty, focused on the health sector and under the theme United Against COVID-19. US President-elect Joe Biden has flown to Washington, D.C. ahead of his inauguration this Wednesday. Iran's army kicked off a ground forces drill along the coast of the Gulf of Oman this Tuesday as tensions rise with the United States. From the headquarters of teleSUR English in Havana, Cuba, this is From the South, and I'm Katrina Goss. This Tuesday afternoon sees a special meeting of the Social Council of the Bolivarian Alliance for the Peoples of Our America People's Trade Treaty, focused on the health sector and under the theme United Against COVID-19. The meeting's being chaired by ALBA-TCP Executive Secretary Sasha Laurenti, who offered the opening remarks of the public session, which saw statements from health ministers and authorities of member states of the bloc. The authorities are continuing their discussions on joint strategies to confront the pandemic in a closed-door session before releasing a final statement on their agreements reached. And the Executive Secretary of the Bolivarian Alliance for the Peoples of Our America People's Trade Treaty, Sasha Laurenti, announced the results of the meeting held to strengthen efforts to address the COVID-19 pandemic.
Whose objective is to constitute the bank for the acquisition of the ALBA vaccines, as agreed at the 18th Summit of the Bolivarian Alliance for the Peoples of Our America, as well as the Medicines Bank to help improve access to medical supplies, rapid tests, and PCR tests in favor of all member states.
And ALBA-TCP will also strengthen the participation of member countries in negotiation processes for the development of a more efficient and effective mechanism for the joint purchase of vaccines and medicines for the treatment of COVID-19.
To speed up the exchange of good practices for the fight against COVID-19 that allow to share experiences in addressing the pandemic according to the measures and treatments implemented by the systems of participation of ALBA-TCP member countries in the existing negotiation processes.
Venezuelan Health Minister Carlos Alvarado explained the strategy adopted by the government of President Nicolas Maduro to combat the COVID-19 epidemic during the ALBA-TCP meeting.
The use of masks, permanent, obligatory use of masks in all spaces, and just like that, the radical quarantine, the suspension of activities since the first cases appeared. Those measures were taken at national level. Also, the national protocols were elaborated with important collaboration from China and Cuba, since before the first cases appeared in Venezuela, which allowed us to attend to the cases that initially appeared. Preparation of the health facilities, some hospitals were created that we have put on guard duty, where we gathered the professionals and prepared the spaces for the care of moderate and serious patients. We also organized coordination with the private health sector and with the hotel sector to increase the capacities to accommodate patients who had to be isolated for their treatment, as well as the supply of free medicine for all the COVID-19 cases.
And Cuba's Deputy Minister of Public Health, Regla Angulo, shared some of the measures adopted by the Cuban government to contain the spread of COVID-19 in the country.
Capacities in terms of infrastructure, organization and human capital of the public health system have been decisive, together with the use of products, equipment and innovative inputs from the Cuban medical, pharmaceutical and biotechnological industry, which has developed a portfolio of 29 products based on antiviral, anti-inflammatory drugs, diagnostics, vaccines and medical equipment. Ladies and gentlemen, the active surveillance and coordination of intersectoral, transdisciplinary and preventive actions have been essential. It is addressing the health emergency.
And Bolivian Minister of Health, Jason Olsa, pointed out that access to vaccines against COVID-19 is fundamental to defeat the pandemic.
We believe that the vaccine, the structured response to this pandemic in Bolivia, the vaccines against COVID-19 will be applied in totally free and voluntary way. To date, we have signed contracts to obtain the Sputnik V vaccine, which has an effectiveness higher than 92%. The first 6,000 doses will arrive in the coming days. before the end of January, and they will be applied to the health personnel on the front line of the fight against COVID-19.
On Monday, the government of Guatemala stated that Honduras had failed to comply with the commitments made to prevent migrants from that country entering its territory. Guatemalan Foreign Minister Pedro Brolo accused Honduran citizens of having entered the country in a violent manner, a situation that, according to the diplomat, contradicts the agreements made with Honduras. He argued that Honduran authorities should dissuade and control the migratory flow, respecting the human rights of its citizens. He also said they did not comply with the health protocols, with 20 people testing positive for the coronavirus. Finally, the minister ratified that together with Mexico and the United States, his government would cooperate to address the Honduran crisis. So far, 2,883 participants of the migrant caravan have been deported. In the wake of the violent attack against the migrant caravan, several human rights organizations in Honduras condemned the version of the authorities of that country, according to which organized crime was behind the massive exodus. Activists stressed that the criminalization by the Honduran government of its citizens who are forced to emigrate legitimizes the repression by security forces in so-called safe third countries. They recalled that these men, women, many of them pregnant, and children are not criminals, and that the criminals are those who force them to flee their country. Activists have reported that there are 12 citizens detained in Guatemala and 25 have tested positive for COVID-19, many of them children. As a safe third country, Guatemala is obliged to preserve the rights of migrants, and human rights organizations are demanding that the right to asylum and the integrity and dignity of migrants be respected. The COVID-19 virus continues to spread in Colombia, having left more than 49,000 people dead. Almost 2 million infections have been detected. The precautionary measures that the government has adopted to date have not served to prevent the spread of the virus. Official records of the health system reveal that 373 people died in recent hours, taking the overall death toll to over 49,000. 10 months after having registered the first case in a South American country, the surge in cases continues, with over 14,000 new cases reported on Monday. The capital, Bogota, Antioquia and the Valley of Cauca continue to be the main epicenters of the epidemic. US President-elect Joe Biden has flown to Washington, D.C. ahead of his inauguration this Wednesday. Biden and his wife Jill Biden took off from Newcastle Airport in Delaware on Tuesday afternoon on the eve of his inauguration, with the usual backdrop of celebrations replaced by a military lockdown of the US Capitol. Biden choked up in remarks before departing Delaware, acknowledging that the moment was kind of emotional. Speaking at a National Guard barracks named after his deceased son, Bill Biden, the president-elect said, "It's deeply personal that our next journey to Washington starts here." Biden will spend the night at Blair House, the guest residence across the street from the White House, one of just a few traditions being honored during the most extraordinary transfer of power in most Americans' lifetimes. Italian Prime Minister Giuseppe Conte was hoping to win a vote of confidence from the Italian Senate on Tuesday as he struggled to save his coalition government. Conte won a crucial vote in Parliament's lower house Monday night after coalition defectors lawmakers abstained in the balloting, but he must clear a much tougher hurdle in the Senate to hold on to power.
Project, and we ask all the political forces to help us relaunch with the maximum speed and help us repair the damage to citizens' trust that the crisis has produced. If the Parliament will give its confidence to the government, I guarantee to all of you and to all citizens that we will not only continue to use all our physical and intellectual energy to carry out our duty, but we will also add, as always, our hearts.
And we stay in Italy, where explosions from Mount Etna, Europe's largest active volcano, sent lava rocks flying into the air overnight on Monday and left orange streams oozing down the slopes. The lava flowed into an uninhabited valley, while ash blew over some of the nearby towns. There are no risks for the local population, according to authorities. The volcano continued to be active on Tuesday. Etna is the largest of Italy's 3 active volcanoes, which also includes Stromboli on the Sicilian island of the same name and Mount Vesuvius near Naples, which last erupted in 1944. As Spain struggles with a surge in COVID-19 cases, a new Madrid hospital, seen by many as an extravagant endeavour when it opened in December, is being given a fresh chance to prove its utility. With a spiralling surge of contagion once again placing Spain's public health system against the ropes, staff at the Nurse Isabel Sendel Hospital, a project deemed by some as a vanity enterprise, are now tending to several hundred patients. On Monday, 392 COVID-19 patients were being treated, more than in any other hospital in the Madrid region. The Isabel Sendel Hospital is named after a 19th century Spanish nurse who took smallpox vaccination across the Atlantic Ocean. The facility was built in 100 days at a cost of €130 million, more than twice the original budget.
This is a hospital that is prepared to give all the COVID treatment. It is a monographic hospital. Its specific task is to deal with this pathology, this pandemic and the consequences of the pandemic. All I say is be very careful. Everyone in my family got it, but they got it easy, asymptomatic. But in all truthfulness, I didn't expect this to be so tough. What we have realized with COVID is that support of the intermediate ward is fundamental for the intensive care ward. If we can admit patients to this ward early, we can avoid 60% of patients being put on a ventilator.
British Health Secretary Matt Hancock said he's self-isolating after being alerted by the country's coronavirus contact tracing app. The Health Secretary posted a video on his Twitter account on Tuesday saying he would not be leaving his home until Sunday and urging everyone to follow the rules. In March last year, Hancock revealed he had tested positive for the coronavirus, just hours after Prime Minister Boris Johnson announced he too had tested positive. The UK is facing the highest COVID-19 death rate in the world, and a surge in cases amid a lack of efficient measures to curb the spread of the virus, with hospitals in the capital London completely overwhelmed.
6 days, and together, by doing...
During a visit to the headquarters of the regional health authority in Ile-de-France, the French health minister recommended making sure that the masks worn by the general public comply with industrial standards, following new recommendations from the High Council of Public Health.
We don't have the 6 million vaccines at this stage, so we are operating on a just-in-time basis. Each time vaccines are delivered to us every week, they are immediately distributed to the 900 vaccination centers throughout the country. And so, as these vaccinations arrive, we open up vaccination slots. Today, more than 2 million appointments will have been made by French people aged 75 and over. So you can see that this is already a significant number, but there are still 4 million who have not been vaccinated. So as long as we don't improve the vaccination coverage of the over 75s, we are not going to enlarge the public. Otherwise, there will be a lot of disappointment, of course.
A new variant of COVID-19 has been detected at a hospital in Germany. The hospital recorded a total of 73 infected patients and health workers, and a new mutation of the virus has been discovered among 35 of them. The new variant is different from those first discovered in the United Kingdom, South Africa and Brazil. Doctors have not yet learned how contagious or how deadly this new strain is. Scientists are studying the variant and will release their official test results by the end of the month. Meanwhile, local authorities and hospitals have told residents not to panic, saying that the situation is under control. Turkey has begun vaccinating people aged over 90 as part of the rollout of its national vaccination programme. Nursing home residents and their caregivers have started to receive their first jabs. Turkey began its vaccination programme on January 14th, a day after the country approved the vaccine developed by China's Sinovac biotech company for emergency use. Close to 850,000 healthcare workers have already received the first of 2 doses of the vaccine. To date, Turkey registers nearly 2.4 million COVID-19 cases and over 24,000 deaths. Iran's army kicked off a ground forces drill on Tuesday along the coast of the Gulf of Oman. The drill is the latest in a series of military exercises that the country is conducting amid escalating tensions over its nuclear program and Washington's pressure campaign and sanctions. Commando units and airborne infantry are participating in the annual exercise, along with fighter jets, helicopters and military transport aircraft. Iran's National Army Chief is overseeing the drills. Tensions between Washington and Tehran have increased amid a series of incidents stemming from Trump's unilateral withdrawal from the Iran nuclear deal and the reimposition of wide-ranging economic sanctions. In response to the lack of compliance by the other parties to the nuclear deal, Iran has gradually abandoned the limits that the deal had imposed on its nuclear development.
The general goal of this drill is to assess the offensive and penetrative power of the ground forces against the enemy from air, ground and sea.
Malawi has transformed the Bingu National Stadium in the capital into a COVID-19 field hospital. The government has imposed its first lockdown amid a rising number of infections, over 13,000 confirmed cases and 321 official deaths. Judges ruled in April that insufficient measures were in place to cushion the loss of livelihoods in one of the world's poorest countries, where most people work informally. Malawi, like many African states, is now grappling with a rise in infections after months of relatively low figures. President Lazarus Chakwera ordered a nighttime curfew late on Sunday and said schools would be shut for 3 weeks. Gatherings have been capped and face masks will be mandatory in public for the first time since the start of the pandemic.
Now the situation is becoming worse because we have seen an increase in the number of patients, said in the wards as well as in our clinics. So like hospital, it will give a relief to the way we have been handling the patients. Because now what we will be doing, those that are severely sick, they'll be coming here. Those that are a little bit stable, but they are need of admission, they'll be going to Bingu National Stadium.
On Monday, Morocco's health ministry confirmed the presence of the new COVID-19 variant discovered in the United Kingdom. According to health authorities, the variant was detected in the northern port of Tangiers in a Moroccan national returning from Ireland via Marseille. Morocco has announced plans to launch a free vaccination campaign targeting 25 million people, which comprehends 80% of its population, using the AstraZeneca shot and China's Sinopharm vaccine. On December 23rd, Morocco imposed a nationwide 4-week curfew from 9 p.m. to 6 a.m. to contain the virus. Health experts have raised concerns over new highly transmissible mutations of the virus, first reported in the UK and South Africa, and now spreading in several other countries. Chinese authorities on Tuesday deployed additional medical experts to aid rescue attempts for at least 12 miners who've been trapped underground in a collapsed gold mine for more than a week. Local officials said rescuers are in telephone contact with 12 of 22 workers who remain underground and are in good health. However, the fate of the other 10 remains unknown. Hundreds of rescuers were drilling 6 shafts in an attempt to reach the different parts of the mine, as well as seeking to clear debris left by an explosion on January 10th. Workers passed a note to the surface on Monday saying they were suffering from toxic fumes and rising water levels. Mine managers have been detained for waiting more than 24 hours before reporting the accident. Multiple car accidents were reported on an expressway during heavy snowfall in northeastern Japan on Tuesday. Local media showed footage of a vehicle pile-up involving over 130 vehicles, which occurred around noon local time. According to local authorities, 1 person was killed in the accident, with 17 other people taken to hospital, according to police and firefighters. As a result of the accident, more than 130 vehicles were stranded and some 200 drivers and passengers affected in what police say was likely a whiteout. Heavy snowfall blanketed wide areas of northern and northeastern Japan on Tuesday, with the weather agency warning of gales and snowstorms disrupting traffic. And we've come to the end of this news brief, but remember you can find these and many other stories on our website at telesurenglish.net. You can also join us on social media, Facebook, Twitter, Instagram and Telegram. For teleSUR English, I'm Katrina Goss and thank you for watching.